Hello everyone, welcome back to the channel. If you are new to medical billing, or if you want to start your career as an AR caller, today's topic is made just for you, because this topic decides whether a medical claim gets paid or denied. So, in this video, we'll learn what is authorization in US healthcare, why it's so important in medical billing, how the authorization process works step by step, and what every AR caller must check before billing a claim. Stay with me till the end. I'll make this topic super easy and crystal clear for you. Now, let's start with a simple question. What is authorization in medical billing? In the US healthcare system, authorization, also known as pre-authorization, pre-approval, or pre-certification, means the same thing. Authorization is a permission or approval from the insurance company before a patient receives a specific medical service or treatment. In simple words, if a doctor wants to perform an expensive or special treatment, they must first get approval from the insurance company. The insurance company then checks if the treatment is medically necessary under the patient's policy. If they agree, they give a green signal, saying, "Yes, we'll cover this treatment." Once that approval is received, the doctor can go ahead and perform the service. This approval process is called authorization or prior authorization. But if the doctor performs the service without getting authorization, the insurance company can deny the claim, and the patient might have to pay the full amount out of pocket, which can be very costly. So, always remember, authorization means getting pre-approval from the insurance company before performing certain medical services. It ensures that the service is covered under the patient's insurance plan and that the provider gets paid without any claim denials. Now let's understand why authorization is so important, not just for the insurance company, but also for the provider and the patient. Authorization works like a safety check that protects everyone, the insurance company, the provider, and the patient. And it keeps the entire process fair, transparent, and under control. For insurance companies, authorization helps them prevent unnecessary or overused treatments that are not medically required. It makes sure their money is spent only on the treatments that truly help the patient, not on services that are wasteful or unrelated. For providers, authorization protects doctors and hospitals from claim denials later on. When the provider gets authorization in advance, they have proof that the insurance company has already agreed to cover that service. So, when the claim is submitted, there's less risk of rejection or payment delay. For patients, authorization helps patients avoid surprise bills. It also gives them a clear idea of what's covered under their insurance plan and what's not before they get treated. This helps patients make better financial and medical decisions. In short, authorization keeps the entire system balanced, transparent, and in control. It ensures that healthcare stays fair, protecting the payer, the provider, and the patient at every step. Now, let's understand how the authorization process actually works. Step by step. Step 1. Doctor's recommendation. It all begins when a patient visits the doctor. After checking the patient's condition, the doctor decides that a test, surgery, or special treatment is needed. It could be an MRI, CT scan, heart surgery, or any major procedure. Before moving ahead, the doctor or the hospital must check if the patient's insurance requires prior authorization for that particular service. Step 2. Authorization request. If authorization is required, the provider, which means the hospital, clinic, or doctor's office, sends a pre-authorization request to the insurance company. This request usually includes patient details, provider details, CPT and ICD codes that represent the service and diagnosis, supporting clinical notes or medical documents showing why the service is medically necessary. All these details help the insurance company understand why the service is needed. Step 3. Review by insurance company. Once the insurance company receives the request, their medical review team checks everything carefully. They confirm two things: whether the requested service is medically necessary and whether it is covered under the patient's insurance plan. Step 4. Decision. After reviewing, the insurance company makes a decision. They may approve the request and issue an authorization number, also called a pre-auth number, deny the request if they find the service is not medically necessary or not covered, or ask for more information before making the final decision. This step is very important because the authorization number acts as a green signal for the provider to move forward. Step 5. Claim submission. Once authorization is approved, the provider can safely perform the service or treatment. Later, when submitting the claim to the insurance company for payment, the authorization number must be mentioned on the claim form. This tells the insurance company that the service was pre-approved. Step 6. Claim review. Even after authorization, the insurance company reviews the claim once more during claim processing. They may check the medical records again to make sure everything matches the authorization and policy terms. Only then do they make the final payment decision. So this is how the authorization process works in U.S. healthcare, from the doctor's recommendation to final claim payment. Remember, getting authorization on time not only prevents denials, but also ensures that the provider gets paid and the patient stays protected. Now, let's take an easy example to clearly understand what authorization is and how it actually works. Suppose you need knee surgery that costs around $5,000. Before your surgery, your doctor's office contacts your insurance company to get approval. They send all the required details, such as doctor's notes, your diagnosis, and the CPT code for the surgery. Once the insurance company receives these details, they review them carefully to check if the surgery is medically necessary and covered under your insurance plan. If everything looks good, the insurance company approves the request and issues an authorization number. Now, after the surgery is done, when the provider sends the claim to the insurance company for payment, they must include that authorization number on the claim form. If the authorization number is missing, the insurance company will deny the claim, even if the surgery was successful and medically necessary. As an AR caller, you must remember, authorization confirms that the service is medically necessary, but it does not guarantee payment. If a claim is denied for missing authorization, it will usually show denial code CO197, which means authorization required. So, always make sure authorization is obtained before performing the procedure or service, and keep all authorization documents safely for audits and future reference. And when you're resolving a denied claim with CO197, first, check if authorization was actually required for that service. If yes, check whether it was obtained before the date of service. Then, confirm if the correct authorization number was added to the claim. If any of these details are missing or incorrect, the claim will be denied again, causing more follow-ups, wasted time, and delayed payments. That's why smart and professional AR callers always check authorization status during both eligibility verification and claim follow-up. If you're new to medical billing, always remember this golden rule. No authorization, no payment. So, always check authorization before billing, not after the denial, because doing it right the first time saves you, your provider, and your patient a lot of time, stress, and money. I hope now you clearly understand what authorization means in U.S. healthcare and why it's so important in medical billing and RCM. If this video helped you, make sure to like, share, and subscribe to our channel for more job-ready medical billing lessons, made simple for everyone.